So now we're going to jump into the kind of the safety and the efficacy of surgical ablation, especially in the concomitant maze procedure setting. So Dr. Nibad has published a lot of papers on the Cox Maze 4. But one thing that that's been great is that he's really got into kind of the safety of the procedure in different settings, and I think that really speaks to a lot of surgeons, because often we're not treating AFib in the isolated setting, right? Most of the time we're taking patients to the operating room for another diagnosis, whether it's coronary valve disease. And the slides that are coming up are going to speak to, is it safe to perform surgical ablation in that concomitant setting? So here's a one slide that really tackles that issue when you're talking about mitral valve disease. So is the mitral valve concomitant maze a safe operation, and what are the long-term outcomes? So this is a paper that was published back in 2018. And first and foremost, what you can see is you really have restoration of normal sinus rhythm in 90% of folks at 1 year. So the Cox Maze 4 in this setting is effective and it's safe, less than 5% complication rate. You can see the numbers for yourself: very low stroke risk, very low risk for re-op for bleeding, low risk of dialysis, 2%, and then perioperative complications, pneumonia, UTI, things like that are really small. I think one thing that surgeons often kind of talk about is, will the increased clamp time lead to further complications down the road, or perioperative complications? And this is one of those studies, and Navad even mentions in this study that, yeah, he acknowledges that there is an increased clamp time, even up to 60 minutes in some patients, but that does not necessarily lead to complications. And quite the contrary, these patients tend to do better, because these patients are normal sinus rhythm postoperatively, as opposed to AFib. So here's another study coming up through Navad's group, and this study again is looking at the mitral surgical patient population in the maze procedure. And what's nice about this study is he really demonstrates AF burden over time. So looking at this table here on the left, what you can see is on the y-axis is percent AF burden, on the x-axis is years of follow-up. And so long follow-up, 7 years. And what you can focus on is in the kind of the blue lines here, that's 100% normal sinus rhythm. So that's an absolutely fantastic result. But what's also a very good result is if you combine the gray, the white, the yellow, and the blue, these are folks who have very low AF burden, so less than 1 hour of AF. And so that's significant restoration of normal sinus rhythm. And the black is really just continuous AF, and you're looking at less than 10% continuous AF. So this is in the mitral valve surgical population with a maze procedure. Really nice results. Patients are doing well. Here's another study. This is Dr. Rankin out of his group and Dr. Badwar out of West Virginia, where they're looking at the association between surgical ablation and mitral valve procedures again. And the big kind of take-home point of this study was they had 4 groups. Group 1 was no prior diagnosis of AFib, so obviously they did not undergo surgical ablation, 50,000 patients in the STS database. And what's really compelling is when you compare those patients to this group 4, these are patients who had a preoperative diagnosis of atrial fibrillation, underwent surgical ablation, 16,000 patients, and what you actually saw is similar operative mortality, similar other complications, similar permanent stroke risk. In other words, if you have a patient with AFib and you treat it with the surgical ablation, you're going to reestablish basically the same clinical trajectory as somebody who had no preoperative AFib and did not undergo a surgical ablation. So again, really kind of compelling data that treating somebody with AFib can really restore a normal clinical pathway for them.